What's going on, everybody? This is Dr. Rindy. Today I'm talking to you about Occam's razor. So when you're talking to a provider and you have a condition and you tell the provider that you have like 4 or 5 different symptoms: fatigue, weight gain, skin dryness, irritability, and if those are looked at as separate and distinct problems first, you might walk out the door with 4 or 5 different medications or treatment plans. Luckily, Occam's razor is a concept that's taught to clinicians, even primarily in Western medicine, but it seems like we've gotten away from it as a way of practice. It's a way of processing a decision clinically so that the simplest explanation is strived for to unify a group of symptoms. So, for example, going back to what I said earlier with fatigue, weight gain, skin dryness, and let's say constipation, if those were distinct diagnoses, we might have 4 different medications given to a patient. But stepping back, certain conditions may present with all those symptoms. So like hypothyroidism, for example, presents with all those symptoms, and it could be a simple explanation that unifies those symptoms together. So that followed up with blood testing. If they confirm that the thyroid needs some support and there is a hypothyroid situation, then that is one problem that's unified versus being put on multiple medications and hoping that you just magically feel better. So it's always concerning to me as a provider when we're coming up with new diagnoses, when a patient will have 4 to 5 different conditions that all kind of look alike, but they've been given separate diagnoses. Perhaps there's a way to unify, and that the problem's actually a unified problem. So this is something that's very important for us to practice as clinicians. And also, this is when you go to a provider that practices Occam's razor in their thinking, they can really save you from getting lost in Googling your medical conditions. If you type in, say, fatigue into a Google search engine, there's going to be so many possibilities. And if you typed in fatigue and constipation, there's going to be a lot of possibilities. So when you talk to a clinician, the more that things stack and group together and are clustered together, then we can kind of think clearly about what the problem is at hand. So I'm just sharing something that's kind of came up today when I was talking to a patient, because the patient, was sort of going to more exotic explanations of their problems, and which we might ultimately go there, but you need to start with common processes and kind of do common things first before you get into exotic explanations of a condition. So this is just me sharing something for you today. Hopefully it's interesting and helpful. Take care.